Welcome to Flow 360. I'm your host, Dheeraj Radikari. Today I have Richard Saban. Welcome to Flow 360.
Hey, how are you doing?
Good, how are you?
I'm doing fine, thank you.
Great. So you're Senior Clinical Research Associate with ICON,
Correct, yes.
correct? Okay,
Yeah.
awesome. We're so happy to have you here today. First thing first, I want to ask you, where were you born and raised?
Well, I was born in the United States. I was actually not from Texas, but I was raised in Texas. So I was
Gotcha.
born on the East Coast in New Jersey,
Mm-hmm.
and I moved to Texas basically when I was 4 years old. So I essentially grew up north of Houston area,
Mm-hmm.
and I claim Texas. So yeah,
Okay,
but yeah.
awesome. So was most of your childhood here in Texas in one spot, or did you guys move around a little bit?
No, pretty much no, Houston area.
Okay.
And then when I came up to college,
Hmm.
that's when I moved over here.
Okay.
But
So
yeah,
early on, your high school education happened in Houston, and then where did you go for your college?
uh, in San Marcos at the time it was called Southwest Texas, so
Gotcha.
now it's called Texas State.
Yeah.
So
Okay.
yeah.
Okay. And what did you wanted to study as a high schooler? What did you wanted to get into right after high school?
Um, well, I was looking at doing the pre-det program,
Mm-hmm.
and I had a lot of interest, but just kind of narrowed it down just to try to go into medical.
Gotcha.
So
Was that something that you were looking into as early as you were a kid, or is that something that happened eventually as you studied more biology and science courses?
um, I think it's more of just I mean everything was an influence, right?
Gotcha.
From watching TV shows,
Mm-hmm.
movies,
Mm-hmm.
obviously, and family.
Yeah.
My heritage is Filipino, so I mean, a
Gotcha.
lot of times with that, I mean, I guess a lot of it's kind of like the traditional route of
Yeah.
like engineering.
Nursing and medicine.
Yeah,
Yeah.
something in the lines of that. At first I was kind of like, I don't know if I want to go in that direction because
Mm-hmm.
I also have like an engineering type of mind too as
Mm-hmm.
well, like to tinker with things, and
Mm-hmm.
but then I also love to help people as
Yeah.
well. So I was thinking about you know doing something with nonprofit.
Uh-huh.
Then I'm environmental, so I just love everything,
Yeah.
right? But yeah, I just kind of narrowed it down to like maybe the medical field was something where it was like one package,
Yeah.
right?
Yeah.
You could kind of do all that aspect of
Mm-hmm.
helping people. You could
Do some
do
research.
some research, right? Things
Yeah.
of that nature. So,
Awesome. As for you mentioned being a family, being with a family who were from Philippines, right?
yes.
How was your family structure? Were they pretty supportive of whatever you wanted to get into, or how was the situation, family life?
Yeah. Obviously, I'm first generation
Mm-hmm.
born here in the United States. So, that acclimation of, my parents just kind of acclimating to
Yeah.
American life. So, I think they were supportive as can be, just trying to understand the environment and
Gotcha.
education, right?
Mm-hmm.
I mean, education is different in Philippines, right?
Mm-hmm.
That you have more, I guess, more respect for teachers,
Yeah.
and it's kind of like one way versus here, it's a little bit more lenient and
Mm-hmm.
not too much punishment. Yeah,
Yeah.
if you know what I'm talking about.
Yeah.
And but yeah, in terms of career choices, right? It's I don't know. I don't know if it's like a traditional thing, but right, just again that the track of you know, I guess in the Philippines, there's not a lot of jobs,
Mm-hmm.
so mentality wise, it's they're just really one track in terms of like, hey, it's good to have a job, and so kind of going to the arts or that's kind of more of a hobby type of
Mm-hmm.
thing, and like again the medical engineering and something I don't know if it's secure but practical
Yeah.
maybe
Yeah.
and so yeah I think they were supportive regards to that. Yeah.
How much do you think that impact in terms of having parents who are supportive of what you want to study or what you want to get into? How much do you think that actually benefits young kids?
It benefits a lot, right? Because one thing that when I was growing up, what they would instill in us is how lucky we are, right? How because again, the education system here, the education's free, essentially free here,
Yeah.
right? We have a public school system. Philippines, you have to pay for it, things of that nature. So, like some of those stories my dad was telling me was like his older sisters, right? It's kind of like you would have to take turns, right? His older sisters would, when they were go to work, they would pay for the younger kid to go to school. So it's just kind of like that family dynamic that everyone helps, But yeah, just the idea how important school is, education, and that one thing my dad was telling me is like education is something that no one can take away from you.
Yeah.
So that's important. So, and it just kind of helps you along the way. So.
Well, knowing that education gives you different options
Yeah.
to even find a job.
Correct.
What's your opinion on pursuing higher education?
Yeah, I would say, yeah. I mean, obviously, as the world progresses, right? I mean, it's rare. You have to have at least, they say is at least a college degree that they hope so. It's not a deterrence, right? There's what I deem with education, right? I mean, obviously you have the traditional route with you have to go university, but there's a lot of other avenues, right? Technical schools, vocational schools.
Yeah.
I think what I look more into that is whatever interest you have, that you have a hunger to want to learn more of what you want to do. So, and that will take you into further education, whether it's if you want to get a master's, you want to go up to PhD in medical school. If you're into cars, automotive, right? You're getting more certifications, things of that nature. So whatever industry you're getting into, you just want to, whatever it takes for you to learn more, if it requires you to get certificates, so you can be credible, and to land you the next job. So I'm not too worried about, or I don't try to instill like, hey, it's always just university, right? Because
it kind of depends on what the kids are
correct.
interested in doing.
Yeah, it's really just the interest. Yeah, it's really the interest. So it's not, you might be the smartest person, but your grades might not reflect that, right? I mean, you hear all those stories with like Bill Gates, for instance, right? I mean, he didn't graduate university. And you have a lot of tech people too as well, where sometimes university is a little bit behind on what's going on with technology, right? So, right, as long as you have that hunger to want to learn more and understand that more knowledge will benefit you. Yes, it will just automatically pursue you to get more knowledge. So
awesome. So how is the field of clinical research? How do you like it? What are some pros and cons within your own sector?
Yeah. So the industry, obviously, I'm more into the pharmaceutical sides of clinical research, and so if you're I don't know if your audience is familiar with clinical research. So when you have those commercials that say what's the latest drug, like Ozempic, for instance, right? And they say, 20 people taking Ozempic participated in clinical trials and they experienced so and so and so. So that's the industry I'm part of right there. That I'm not in pharmaceutical sales, things of that nature. But yeah, I mean, the industry itself there's a whole lot of avenues you can get into, like sales, the research side. I'm on the clinical side, which is still research, right? But Opportunities, yeah, there's a lot of opportunities in it, and the way I got into it was just I didn't know about this side of
Mm-hmm.
clinical research.
Mm-hmm.
Essentially, I just kind of knew kind of university research, right? You know,
Mm-hmm.
the professors will get a paper, and then I always thought, right, like maybe the big pharmaceutical companies will just find a thesis and say, hey, we're going to add on that,
Yeah.
and so I didn't realize all these other clinical trials going on, and just the pipeline of everything that supports
Yeah.
drug development. You
Okay.
know, so.
Okay. And like, do you get promoted within the field? Is it a field that you can go within, or uh, do you have to pursue education in order to get promoted, or how does that look?
Yeah, there's a lot of levels to it.
Mm-hmm.
The role I'm in, yes, you could get promoted
Mm-hmm.
to, um, management level,
Mm-hmm.
director, things of that nature. Like I said, I'm more on the operations side of the
Mm-hmm.
clinical research. So you have, I wouldn't say a traditional path, but obviously you have people who need to manage,
Mm-hmm.
oversee the workers, and then the directors over them and things of
Yeah.
that nature. Obviously, the field that I'm in, there are a lot of higher education
Mm-hmm.
folks
Mm-hmm.
who have like PhDs,
Mm-hmm.
things of that nature. Obviously, doctors,
Yeah.
MDs of that
Mm-hmm.
nature. But no, there's many levels where I don't have a MD. I'm not an MD or anything. I just
Mm-hmm.
have a bachelor's degree,
Yeah.
and yeah, it's very. I would say
And
it's.
you enjoy research.
I do.
Yeah.
I do. I do. I like the idea of it.
Mm-hmm.
And that's one reason why I got into it, because it's I'm part of a somewhat community
Mm-hmm.
that makes life saving drugs,
Yeah.
right?
Yeah.
So I know, like when you watch TV and you watch things of like firefighters or police and NCIS, it's all this
Mm-hmm.
action stuff. There's also a lot of support people around that
Yeah.
also, and it's not always the guy in the infantry,
Mm-hmm.
and so that's why there's a lot of parts to it, and I'm glad to be part of that
Yeah.
industry and say that, hey, you know what, I did work on that drug, right?
Yeah.
So
Yeah. That's cool.
yeah,
As a researcher, I'm sure you get to travel a lot, and I know you enjoy traveling.
yes.
How is that?
You know what? It's traveling is good. I mean, it's not bad. I mean, obviously you have to. I mean, I'm not going to sugarcoat it, right? I
Mm-hmm.
mean, there's a difference of business travel and vacation travel,
Mm-hmm.
right? My role, it does require a lot of traveling,
Mm-hmm.
so I have to and it's all dependent
Yeah.
on the study.
Gotcha.
So where we recruit clinics, once they finally get on board, then it could be all over the United States. And
Mm-hmm.
then obviously how big our team is, then you can divide it up on what regions
Mm-hmm.
um, people get to travel. So me being in Texas, I'm kind of central. I could go either east, west,
Gotcha.
coast, and so a lot of my sites right now is on the west coast.
Mm-hmm.
So I'm traveling up from Seattle all the way down to San Diego.
Mm-hmm.
I have a site in Puerto Rico
Mm-hmm.
right now, and we are going through another allocation where I'm still having those West Coast sites, but we have another person leaving our team, but I have to take over her sites, which is now East Coast. So I'm going to Maryland now and Virginia.
Mm-hmm.
So yeah, there is a lot of traveling on
Mm-hmm.
that. So
Is this a field that's growing in the next 10, 20 years, or what do you see?
uh, there's always a need, right?
Gotcha.
Because obviously there's a traveling aspect of it, which um, attracts a lot of young folks,
Mm-hmm.
right? Fresh out young professionals,
Mm-hmm.
because a lot of times they have the availability to travel everywhere,
Yeah.
right? They're not uh, they don't have too much. I mean, it's sometimes they're just again young professionals,
Mm-hmm.
and but because of that, and not a lot of people can travel. That's
Yeah.
why it's always there's a need, because you'll get into the industry, and then just wherever life takes people, and they're not able to travel anymore, things of that nature. And then so it's always that cycle of, okay, their needs, and as well, depending how big the study is, So
Awesome. As for some advice for young high school students or college students, what are some of the advice that you would give for somebody that is going to get into the work world eventually?
In general, or just like pharmaceuticals?
In general.
I would say is just education is important. Again, just it doesn't have to be a traditional way, as long as you want to learn and know that learning is important and will get you further than what you were before. And I would just say, I mean, there's this talk about, should you follow your passion or not? I say, yeah, follow your passion, right? Because if you go full force in following your passion, it might lead to different avenues. Right? If you want to be an actor, you might not be that actor, but you like the acting so-called business. There's a lot of things that you could find along the way, and not being just in front of the camera.
Yeah.
And you won't know that until you really dedicate yourself into that path. So like I said, like you do tennis, correct? And you love to coach, my understanding, right? So I don't know if that was the path you took, but you had that passion, and it led to, hey, I like to work with kids, things of that nature. You might not be the pro, right? But in your mind, you're like, hey, this is I like the industry, and I want to stick with it, right? And the money will follow, right? There's no doubt. You have to make a steady living, but if you're passionate about something, the money will follow, and you'll understand what type of standard living that you know what you want, and it doesn't have to be $1 million. You just understand, like, hey, that you'll learn what the important things of life, and you don't want to bog yourself down with that. But yeah, I do feel like follow your passion. If you like to close deals, then that's your passion. It might not be the industry, right? But you're like, hey, if you like to sell cars, and your passion is, hey, I like just to, make the sale, then that's what it is. Not necessarily, I like cars or anything like that. So, but yeah, education, and just knowing that you need to educate yourself to further yourself. So
awesome. Lastly, I'm going to ask you a question. Where, if you could go anywhere right now, anywhere in the world, where would you go and why?
Anywhere in the world?
Anywhere in the world.
Wow. I mean,
one spot, and you're gonna give me a reason why.
I mean, this might be a generic answer, but it's I mean, home. I like to just being at home is great, just because I'm a family-oriented type of person. So it's, I mean, it's, you could go to any place in the world, but if you don't have anybody to experience that with, and just as long as I'm anywhere with my family and share that experience, it's really pretty much anywhere. I would say that I would, there's not a really particular spot, and it's, when I was young, it's like, I want to go to Europe, Spain, things of that nature. But in the end, it's like, well, I mean, I don't want to experience that by myself. So it's wherever we plan as a family, and so, I mean, sorry to be generic answer, but I mean, I'd rather be home experiencing that, and then vacations, things of that nature. So, but
okay. Well, I thank you for your time, Richard. Thank you so much for being here.
Yeah.
Thank you.
Thanks, everyone.